So on behalf of the WHO, that's the World Health Organization, the NHS, all recruitment agencies in the UK, I officially welcome Zambia, Zimbabwe, Rwanda, Timor-Leste, La People's Democratic Republic, Samoa, and Tuvalu to the Red List Club. These 8 new countries have been added to the UK's Red List, okay? There's been 47 countries on the list prior, but now these 8 new countries have been added, making the whole list 55. WHO, why? WHO, why? If you're from any of these countries, I mean, it's nothing scary. Countries like Ghana and Nigeria and 45 other countries have been on this list since 2020. But still, Ghana and Nigeria remain among the highest number of foreign nationals that are recruited by the UK NHS yearly, even though we're on the red list. So it's nothing scary. I've gotten several messages from people from Zambia, Zimbabwe, Rwanda, who are really scared about the current changes, but it's nothing to worry about. There are several ways to go about it, okay? And that's what I'll be showing you in today's video. So if you're interested, stay tuned. If you're hearing red list for the first time, I don't know where you've been because the term red list has been all over the place, but let me quickly give an explanation, okay? This red list thing first became popular in 2020. You know, people thought it was those that had to do COVID tests before they come to the UK. That is a different red list altogether. This is red list with regards to international recruitment. This is red list with regards to WHO. Okay, that's totally different from the COVID time, the countries that were on the UK's red list, and when they come, they have to isolate. That is a different red list altogether. This red list is WHO induced red list, okay? So sometime back in 2020, the WHO came out with a list of 47 countries, okay? And like I said, Ghana and Nigeria are inclusive, and then they said that these 47 countries, they already have pressing healthcare workforce issues or challenges themselves. According to the WHO, when they did their analysis, these countries don't even have enough health professionals on their own, you know, per their population. So the UK should not advertise and target health professionals in these countries, okay? So it's like the WHO trying to say that these countries need healthcare workers, so it's not fair for a developed country like UK to target their health personnel and pull them to their country. So the WHO said that there should be no active recruitment from red list countries. What they meant by active recruitment is that there should be no advertisement of job opportunities in these countries, because if you did not know, during my time, agencies in the UK used to go to these countries to advertise. They could go there and interview thousands of nurses. Okay, thousand is an exaggeration, I know. Hundreds of nurses at a go and give them job offers even before they pass their IELTS and their CBT, you know, just to make the UK attractive. And then they had referral bonuses. If you introduce a nurse who starts working, you get £200. So it was like you are making the UK very attractive, that they are leaving their home countries where they are supposed to be. They are leaving their home countries that need them more because there are not enough healthcare workers in these countries, and you are pulling them to your country. According to the WHO, that was not fair. So the WHO said there should be no active recruitment. One, there should be no advertisements in those countries. You should not promise them referral bonuses, and then you should not use recruitment agencies to pull people from these areas. But they said that once a direct application is made, that's fine. So even if you are from these red list countries, okay, the only thing that has changed now is that you cannot use a recruitment agency to facilitate your movement or your relocation to the UK. But the WHO allows you, the policy or the new guidance allows you to make direct application. So now MMA cannot assist you. That's the agency I came with, but you can make a direct application to a hospital in the UK, apply for a job, and once you get it, that's fine. That's okay. They don't have an issue with you. Their issue is that don't facilitate your movements with recruitment agencies, because they believe that it was recruitment agencies that were doing the adverts and promoting and making the UK so attractive, giving referral bonuses to make people want to do this more, to the detriment of their home countries, okay? So the main thing is you cannot use recruitment agencies, you understand? And this is clearly stated in scenario 14. So I'll leave a link to the gov.uk website that talks all about the rules governing international recruitment and red list and blah blah blah. I'll leave a link there so you can read it for yourself. But to make us understand it, they use a lot of scenarios to explain it. So let's read scenario 14. It says a social care provider puts out a general advert for a number of staff to fill various vacancies within its own nursing homes. The advert is not targeted at any country. The provider receives 60 applications and appoints 3 senior care workers resident in the Philippines, a green list country, and 3 senior care workers resident in Nigeria, a red list country. In this scenario, the nurses resident in Nigeria made a direct application for the advertised post, meaning the They applied independently and on their own behalf. The advert was a general advert, not actively targeted at any country, and was not managed through a recruitment organization, agency, or collaboration. Therefore, this activity would not be deemed as active recruitment and is not in breach of the code of practice. Okay, so the company advertised this generally. They did not target any country. They just advertised on the internet. They got 60 applications, and 3 people from the Philippines were picked, and another 3 were picked from Nigeria, which is a red list country. What the government of UK is saying is that this is not against the code of practice. The company should still give the applicant from Nigeria a chance because they applied without an agency. They applied on their own behalf. Okay, and it's not like the advert was targeted at them. It was a general advert. Okay, so yes, so you can make direct applications. You should not be scared. And another thing about the direct application that I like so much, they said, is that when considering how to handle direct applications from individuals residents in red or amber list countries, employers should be mindful of their responsibilities and that the Equality Act of 2010 not to discriminate or treat applicants differently due to their race, which includes their nationality. Okay, so according to the gov.uk and the code of practice for international recruitment, the managers or the recruiters are not supposed to discriminate because of where you are from. Okay, they're supposed to give everybody equal chance. Okay, so that's good. Let me say that this does not apply to all workers. This only applies to healthcare workers. I'm talking about doctors, I'm talking about nurses, I'm talking about support workers, dentists, and care assistants. Okay, so if you are processing your travel, let's say you are in any of the red list countries and then you are coming here to work as an accountant, you can use an agency because you are not under the health and social care sector. So the WHO did another report this year on health workforce support and safeguards. Okay, according to their reports, now the list is no more 47, is now 55. That means 8 new countries have been added. They said these countries now rank below the global median in terms of their density of doctors, nurses, and midwives per capita. So if you are in nursing school in any of these countries, don't give up. I mean, like I said, people are still coming day in and day out. It's nothing scary, but the only issue is that be ready for rejections. Although the WHO says that if an applicant makes a direct application, the organizations as the care homes and then the hospitals, they're supposed to give this person, you know, the same opportunity like any other person because they're applying directly. Some NHS trusts are still saying that for them, they want to go through the ethical route. So if your country needs you more, they don't know why they should rely on you. And what has made this very easy for the NHS trust to say this is because the UK has an agreement with countries like Malaysia and the Philippines and Nepal. So for them, there's movement of hundreds of nurses every month to the UK. If they can get Filipino nurses when there's no issue and they don't have anything on their conscience, you know, pricking them, why should they come for you when the WHO says your country needs you more? You understand? There are a few things that you can do. You don't have to worry at all. So the first thing I would advise is that you go to platforms like track.jobs, okay, carehomes.co.uk, jobmedic.co.uk, health jobs UK, nursing times jobs, RCN bulletin jobs, LinkedIn, Indeed, Total Jobs, NHS Jobs, homecare.co.uk, and jobs.nhs.uk. All these platforms or all these websites publish vacancies daily. And some of these vacancies, they specify that they need international nurses. So sometimes they can say international nurses, right? Or they can say that we offer COS or sponsorship is available. What I will advise that you do is that you go and create an account. Maybe 3 of these popular ones that I have mentioned, maybe track.jobs, Total Jobs, or carehome.co.uk, and then you create an account. You go there, you create an account, and then you sign up for job alerts. Okay, so there's a way to filter. You can filter based on where you want the job, but since you are now looking for a job, I will advise that you broaden your options or whatever. So search for in the whole of UK. I mean, it's easier to broaden all your options so when you get in and you don't like the place, then you can move somewhere else rather than say you want specifically London. So what if there are no jobs in London? And then filter based on the type of job that you're looking for. So if it's a nursing job as well, you indicate band 5, you know, look for band 5 roles because that's the starting level for international nurses. And then you can sign up for alert. So anytime such a vacancy is posted on any of these platforms, so far as you signed up for email alerts, they'll send you an email. And then if it's something that you like, then you can make your application. So that's the number one thing. thing. Create accounts on these popular job search sites and then sign up for email alert, okay, for jobs with visa sponsorship, okay. The next thing I'll say is that follow channels and Facebook groups, join Telegram groups, okay, that talk about visa sponsored jobs, okay. So if you check my about section here on YouTube, I have my Telegram link that you can join. Day in, day out, people are posting vacancies. Day in, day out, people are sharing testimonies. Day in, day out, people are sharing job opportunities, okay. So you can, keep track. When you join Facebook groups as well, there are so many people there that post job vacancies daily, okay. And on my channel as well, my community page, whenever I come across any vacancy, I post it there. Several people have gotten jobs through jobs that I've posted on my community. So you can follow not just my channel alone, any channel that usually talks about these things and post job vacancies, follow them and then apply. The thing is, these days, because there are no agencies, you have to apply to as many as you can, as many as you possibly can, because now your chances are reduced, because there are no recruitment agencies to do this for you. The recruitment agencies used to make this so easy, and they are in communication with the employer. They already have a relationship with these employers. Immediately there's a vacancy, they are aware, and then it's like fast you are getting there. They still do need quite a number of nurses, okay. So all I will say is don't give up. You can still do this direct application and come to the UK. Another thing is that if you are from any of these countries, the thing is not about your nationality. It's not about your nationality. It's about where you are residing. So like we know, South Africa is not on the list at the moment. Okay, we don't know what's going to happen in the future. But let's say if you are from Zambia or you're from Zimbabwe, but you're currently living in South Africa, this does not even apply to you. Okay, and let me read the scenario 11 so you understand. Okay, so a doctor from Haiti, which is a red list country, is resident in Canada, having relocated there 5 years ago. An agency advertises in Canada and the doctor is recruited in the cohort and wishes to come to the UK. This activity is not in breach of the code of practice. Ethical recruitment is determined by the country from which the individual is resident rather than the nationality of the individual or their original country of training. So it doesn't matter the country you trained, it doesn't matter the country you are from. It's more about the country you are currently living in. Okay, so if the country you are currently residing in is on the red list, that's where there's an issue. If you are from a red list country by birth or by training and you are currently in a non-red list country, these rules, this red list thing does not apply to you. Okay, so if you're a Zambian living in South Africa, this does not apply to you. You can still use agencies. Good, right? So now you get a bit of a loophole on what you can do, right? And another good thing is that once you make a direct application, your CV is shortlisted, you pass an interview, but because you don't know all the, the traveling thing, what you're supposed to do, the things you're supposed to pack, the documents you need, and once you get the job offer, now you can go ahead and use a recruitment agency or a traveling agency to help you with the remaining parts of the process. So long as the recruitment agency or the whatever agency is not the one that helped you get the job, after you've gotten the job on your own through your own direct application, they can assist you with the remaining parts of the process. And this was explained in scenario 12. So this says a social worker resident in Chad, a red list country, makes a direct application to a general vacancy advertised by a local authority in the UK and is successfully appointed. The local authority requires the support of an employment agency to facilitate the social worker through the remaining part of the recruitment process. This activity is not in breach of the code of practice, as the social worker had already been appointed by the local authority when they approached the agency for support with the remaining parts of the recruitment. So the person had already done the hard work. They've already done the direct application, they passed the interview, and they've succeeded, they've gotten a job offer. So the remaining parts of the process, maybe the traveling arrangements and whatever, they can use an agency. And this is on the gov.uk website. I'll leave a link so that you can read. Okay, make sure you're making direct applications and you're supposed to be giving a fair chance, an equal chance, and then sign up for job alert in any of the popular job sites. Follow groups, Telegram groups, Facebook groups, and YouTube channels that advertise UK vacancies. Okay, and there's another way. I left this for last because not everybody can do this because it's quite expensive. It's called the self-sponsorship route. Okay, so let's say you're a nurse in Zambia or Zimbabwe now that you're on the red list, and then you've passed your CBT, you've passed your IELTS, maybe your IELTS is expiring, you've been trying to make direct applications but nobody's minding you. Like I said, said, when there are no agencies, when you're making direct applications, sometimes it can be a bit difficult. Okay, so let's say your country is now on the red list and then you cannot use agencies anymore and all your applications, are unsuccessful, but your IELTS is expiring, your CBT is expiring. You need to hurry up with the process, but there's nothing you can do. If you have the money, you can do what we call the self-sponsorship route. So it's basically you coming to the UK and then doing the remaining parts of the process your own. Okay, you come into the UK on a visit visa and finishing the remaining parts of the process by yourself, self-funded, and then you get your license and then you can apply for jobs. Okay, so now when you're applying for a visit visa to come into the UK now allows nurses and doctors who are coming to write the OSCE or the Plab 1 or the Plab 2 to get a visit visa to come, as long as you can prove that that's what you're coming to do. And I have a detailed video where I spoke about how to use the self-sponsorship route. So I'll leave those links here so that you can watch. Okay, so you can come through the self-sponsorship route. Okay, the only issue is that if you're a care assistant or if you're an aspiring care assistant, you cannot use the self-sponsorship route because there's no other exam to come and write when you get here. It's only nurses and doctors that can use, and midwives that can use the self-sponsorship route. Okay, so it's a bit tough for care workers even if you have money, but like I said, don't give up. Be ready to apply to so many vacancies and be hopeful. Don't give up. Okay, so many people are from red list countries coming daily. So basically that's what this red list whatever is about. Okay, so if you got any value whatsoever from this video, please do subscribe. But maybe if you're meeting me for the first time and then you think that I've not convinced you enough to subscribe, at least give me a like. Okay, next time you can subscribe, but I'll be happy if you subscribe from today anyways. So thank you so much for watching. Bye.